Hi everybody, this is Kate Wakelin from Neuroendocrine Cancer Australia, and I'm broadcasting to our Facebook private discussion group because it's Friday. So it's the 27th of November, and the year is just flying past. So I am the NET patient support nurse with Neuroendocrine Cancer Australia, and each Friday we come in and really look at a topic of the week that is of interest to people affected by neuroendocrine cancer. So welcome those of you who are joining us live, and for those of you who are joining us afterwards on our YouTube channel as well. Just wanted to take this opportunity to acknowledge the traditional owners of the land that I am broadcasting to you from, which is the land of the Wurundjeri people of the Kulin Nation, and I would just like to take this opportunity to pay my respects to elders past, present and emerging. One of the things I love about living where I live on Wurundjeri land is that I'm very close to the Yarra River. And actually this morning I was out running, as lots of people know that I like to do, along the Yarra River, and in the Woiwurrung language, that's called the Birrarung. So every time I'm out there and running by the river, it makes me feel very grateful for where I live. So I know that you are coming to me from all corners of Australia and even beyond. And so I just would extend that acknowledgement of country to those of us who are joining us. So welcome everybody, and also you will notice that I've got someone with me again, and this will be a familiar face to many of you. So I'm very excited to introduce my colleague Meredith Cummins, who is one of our project officer from neuroendocrine cancer, and Meredith has also got an extensive experience as a cancer nurse in neuroendocrine cancer. So we're very lucky to have Meredith as part of our team. And I'm very, very excited because Meredith is going to tell us about a long dreamed about project that has finally come to fruition that we've been working on for many years. So I remember my very first day working with what was Unicorn Foundation back then, and it was in 2015, and I met our fabulous CEO, Simone Layden, and she was taking me to my very first meeting, and she was telling me about all of the things, all of the dreams that she had for the organisation and what we might achieve together. And one of the things that she was so passionate about back then was about GPs, and just explaining that what we know about people with neuroendocrine cancers is that often there is a prolonged period of time before they receive their diagnosis, and often they've been backwards and forwards to and from their GP with various symptoms. And so we knew that we wanted to just make sure that GPs were really aware of what they were looking for when they were thinking about a neuroendocrine cancer and what sort of symptoms to be keeping a weather eye out for. But also knowing that for people who are living with neuroendocrine cancer, that's often a very long journey, if you want to use the journey word, but often it's a long, long time that people are living with neuroendocrine tumours as a chronic condition. And we often have really fabulous oncologists and nuclear medicine physicians and endocrinologists and other specialists who are involved in the care of that person. But at the end of the day, when you're not well, your first port of call is usually your GP. So we're very keen to upskill our GP community so that they would know more about how to manage their patients who are living with NETs, as well as getting in early in the diagnosis. The other thing about GPs is that, and we did a video a few months ago now, sort of looking at, well, who's on your bus, who's actually you're on the team who helping you manage your condition. And certainly I've already mentioned oncologists and nuclear medicine physicians and endocrinologists, and we've got dietitians, and we've got all sorts of team members, nurses. Often I think the GPs can be forgotten in all of this, and I think sometimes, and I think I'm looking forward to having Meredith talk us through some of the research that we've done in this area. I think GPs sometimes have felt like they might not have had the confidence to interact as part of that multidisciplinary team because of their level of knowledge, because there's not a lot in medical training or nursing training about neuroendocrine cancers. So we were so keen to do this project, and I'm super excited to welcome Meredith along, because that means that we have launched it, and anyone who's been watching our Facebook feed or our Twitter or our LinkedIn will know that that's actually the case, that we now have the program. So Meredith, welcome officially to Facebook Friday. I know that you're a member of, our staff team, and you're in the private discussion group, so you see the conversations that happen in this space, and you've been to lots of forums and face-to-face support groups, so you're a very familiar face for many of our patients. But welcome formally to the Facebook Friday video. And Meredith is joining us from Wagga today, so she's been on a long journey. So, and you told me the temperature before.
It's 40 degrees. Yeah, I've just driven 5 hours from Sydney to here, so I'm only sort of think half an hour ago landed. So yeah, but it's going to be 40 all weekend, so it'll be nice and dry and warm.
Well, you look as cool as a cucumber, and thank you very much for making time in a day where you had travel plans to join.
It's all good. It's all good. That's
fantastic.
Very exciting to be doing this. So yeah,
isn't it? Because we've been planning doing a Facebook Friday about the GP program for ages, you and I, and eventually, like lots of projects, the goalposts change a little bit. You're not quite sure when it's going to be a fully polished product to present. Eventually we stopped setting dates for this chat, and we just said, look, when it's done, when we've launched it, then let's set a date to catch up in Facebook Friday together. Yeah. So it's so exciting to be doing this today.
I think some of the problems with it sort of being the goalposts and dates moving around a bit is with some of our clinicians who are on our steering committee, it's like trying to herd cats and getting them to review things, sort of like, it was like, come on, focus. But yeah, they were actually very good, and I didn't have to get the whip out too much to them. So it was excellent.
And I know we know that like our clinicians have so many competing things to prioritise. So quite possibly while they were not reviewing elements of a course, they might have been talking to people who are watching this video now. So we love them and we appreciate them. And I know they do so much for our community, but this is exciting. So I wondered if we could just go back a step and Meredith, just for everybody, Meredith and I kind of nutted out a list of questions that I might ask Meredith, and then I'm taking full liberty in ignoring them completely and
just putting me in the hot seat. It's all good.
Putting Meredith in the hot seat. Because I wanted you to tell us, it's ages since we did the original survey to sort of get a handle on what GPs knew and what they needed to know more about. We were at a group meeting the other night actually, and someone said, oh, I gave my GP's details a long time ago. I don't know what that was really, they couldn't really remember what that was for. Maybe can we go back to that and talk a bit about that survey, and then, because I think that gives us a really good entree into why we've created the modules that were created.
Yeah, so back in 2018, we asked all our unicorns to nominate their GPs, and so we devised a form which we had a lot of people submit their GP's details. After I got that, I went and contacted all the practices that they were in and got email addresses. So I thought the Survey Monkey that we put together, I would email it to all the clinicians. I think we had 77 or 80 GPs that we sent it out to, and I thought this is great. They just have to do it online and it'll come back and it'll be done. Well, I waited a while, I got 2, and I thought, okay, this is not working. So I decided, I took the bull by the horns and I printed out the survey, and I then sent out to everybody a paper version with a stamped self-addressed envelope in it, and got them to fill it out, and I got over 50% back, which was great for GPs. So that was, challenging in itself, and we decided, yes, that sort of snail mail was the most effective way to communicate with the GPs. So that was 2018, 2019, early 2019, when we sort of got all those surveys back, and in them we asked them what they wanted to know, and it ranged from sort of, did you suspect or did you know your patient prior to diagnosis? And majority of them did, but did you suspect a NET? And only 5% of the respondents actually suspected a NET. So that actually shows how complex, how vague the symptoms are. And we went on from there and identified what some of the most symptoms were that they had come through with, which is the diarrhea, weight loss, bloating, flushing, all your common sort of things. I think sort of the diarrhea or irritable bowel sort of things were the highest that were rated. But then we sort of went through and asked them about pathology. We asked them about treatments. One big thing that we did ask them about was whether they got reports back from multidisciplinary teams or consultants' visits, and most of them did. But it was really interesting because a lot said that they really didn't understand the language that was used in the report. So it was great they were getting the reports, but a lot of it they didn't understand. So that was an area that we thought, well, that's something that's very important to look at. But then we went through all the living with NETs, details about finances, about diet, psychosocial, or carcinoid heart disease, carcinoid crisis. And every single one I would say was ticked, yes, 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 we want to learn about it. So we thought, okay, we've got the foundation for some modules. So that was how that started.
And it's interesting, Meredith, that, you know, sometimes we assume a doctor will know a lot about any kind of medical condition, but I think it's actually, in some ways, it's reassuring for me, but I think it also should be reassuring for patients that even a doctor who has done years of training and, you know, has had years of experience will get one of these reports from the multidisciplinary team regarding neuroendocrine cancer, and they're confused by it. So if our GPs don't really understand it, then no wonder it's actually pretty tricky for us all to get our heads around this really complex disease.
Yeah, and I know in face-to-face forums that we've done for GPs around the place. So when I was in Wagga living here, we used to do a lot for the GPs here and get a lot of specialists presenting. But I know in Sydney, we've done quite a few, and we've had to make sure that the language was appropriate for the GP so that they understood what was being said rather than the jargon and all the numbers and all that sort of thing. And they're sort of like, you know, can you speak so that we understand what you're talking about, and then it's actually going to be meaningful for us. So yeah,
exactly. So I wondered if you could tell us a bit about the modules and what sort of things we're actually teaching the GPs who are doing this course.
Yep. So, I mean, we had a fabulous steering committee. We had Brian Chan, who's a medical oncologist from the Sunshine Coast. We had Gabby Checkick, who is a nuclear medicine physician and also an oncologist in Adelaide. We had Diana Leroyd, who is an endocrinologist at Royal North Shore. Rory Clifton-Bly, who also is an endocrinologist at Royal North Shore. Gerald Fogarty, who is a radiation oncologist with Genesis, and he also works, well, it used to be the Melanoma Institute, but it's the Amigos and does a lot of the Merkel cell cancers. Professor Jane Turner, who's a psychiatrist but does a lot of psycho-oncology. Kaylee Schneid, who is a dietitian who used to work at the Royal Free over in London, and it was the world's first NET specialist dietitian, and she moved out to Australia, I think it was about 6 years ago, and we've been very fortunate to have Kaylee, but equally as fortunate to have Erin as well now, so that we've got two fabulous dietitians who are particularly passionate about dietetics for NETs. And we had Tricia Vervliet, who is a GP here in Wagga, who has a particular interest in it, and she felt very privileged to be part of the steering committee. Simone and myself, and then we have medical writers from the company Arterial that put the package together. So there's 4 modules and they're worth 40 points. So every GP in the triennium has to get 120 points. So we've basically wiped out a whole year for them as far as points to make it a bit easier. So then they've only got another 80 points to get within the 3 years as well. So it just makes the load a bit less for them, but it's very comprehensive as far as the information that they're getting. So each module is about an hour. We did patient filming. So we have 4 patients who we went into every aspect from when they first felt there was something wrong, the misdiagnosis, the tests that they went through, the impact it had on their family, their work, financial toxicity, how their diet has changed as well, how their social life has changed. We went into absolutely, and all the treatments that they've had. So, as I said, there was Jacqueline, Cindy, who is actually an SHDB carrier, a gene mutation, and it's actually gone through 3 generations of her family, and all her children carry the gene. But she was fabulous talking about it from sort of like a family perspective, and also talking about one of her children who has a paraganglioma. And then we had Danny, who's a young dad of 4 kids and the sole breadwinner. And then we've got Grant, who has got 2 girls, and he's been living with NETs for quite some time. So they were quite varied as far as the stages of how long they've had NETs. And we went through and dissected each of their interviews and have put that into each of the modules in each of the sections, so that it's real, it's very interactive for the GPs. So
and can I just say it's so generous. No, I was just reflecting, because these 3 out of the 4 patients I've talked with quite a bit, and I just think it's so generous for them to share their stories so that doctors can learn from them, because it's like saying, here, I'll go under the microscope, you can have all of my information if you promise to learn from it. And I think it's incredibly generous of all of those patients to take part. I've seen the films and it was a lot of filming. Do you want to talk a bit about that process, how that went, how that happened, Meredith?
Well, as far as finding them, or or the day, or
how was that?
Well, I was there the whole day with everybody, and I was there in the distance, and each of them sort of like kept trying to look at me for sort of clues, or did I answer that right? And I said, I'm not here, remember, I'm just here. So we had a couple of takes for things, but no, everybody was, as you said, it was a privilege to be there and listen to their stories, and for them to be so generous to share their stories. And it is such a learning tool for GPs. None of them, I mean, everybody had issues along the way, but they were the critique was very positive as far as ways that things could be handled differently for other people. So, and I think sort of the GPs that actually do these modules will possibly sit back and think, oh, yeah, I possibly could have handled that differently, or, oh, I didn't think of that. Because I mean, one of the interviews, she had multiple issues, but everything was just treated as a different issue. She had heart issues, she had stomach issues, she had anxiety, she had various things, but nobody actually sort of put the pieces together for quite a few years. And she said, I was treated by so many clinicians, and I mean, the cost of that as well is astronomical. But then sort of, I think it was only a very junior doctor that suddenly thought, hang on, all these things seem to sort of point to a neuroendocrine tumour. And
it's interesting, isn't it? How many, I don't know how many patients I've spoken to where it's a locum or a student or someone who's young, who's just covering for the day. And sometimes it's that fresh set of eyes. So it's sort of, I guess, it just proves, really, doesn't it, that it's not always about having the most experienced person in the room. It's sometimes about someone who'll think a bit outside the square and put 2 and 2 together and think, oh, if I had one more it would be 5. So and I know that person is actually watching the video live in the Facebook group now. So hello. I'm not going to mention names because it's going on to YouTube, but it's wonderful. Like it's so, and I think from my perspective too, I know as a health professional, I always learn so much from real people, and so to have real stories in this training program for GPs, I think is going to be really powerful.
Yeah, and I mean, one of them, he actually spoke about how having cancer, originally he couldn't even think about discussing or the concept that he had cancer, and he just wanted to deny completely. But then once he sort of had worked through a whole lot of things, he was then actually, he felt like he could say things to people to sort of, if you umming and ahhing about doing something, don't. Go and do it as though, you know, tomorrow's not going to be here. And he said so many people have come back to him and said, thank you for doing that, because I actually did something that I've been putting off, or sort of, you know, thought I'll do it one day, but I've done it now and I'm really happy, and really appreciated his positive input to encourage those people to do something that they'd been hesitant to do. So yeah.
So I wanted to ask you, I know we've talked a bit.
Did you want me to go into what's in the modules? Or?
Yeah, let's do that. Let's dive in.
I thought that we had done, but you had asked, but then we sort of diverted.
This is what we do. When we chat. So tell us a bit more about what's in the modules, because I guess part of the purpose of us having this chat today is so that everybody watching could get your GP to do the modules. So we figure we need to tell you what's in it for the GP.
That's right. Yeah.
So tell us a bit about it.
Module 1, excuse me, is what we've called suspecting nets in general practice. So we're getting them to basically start from scratch and sort of, you know, identifying vague symptoms and then thinking about the appropriate tests to be done and working through all those issues and everything, and then sort of learning about the pathophysiology and the efficient investigations for patients, so that we're not having a whole lot of tests done that are really not going to point to anything. So
because I'm actually going to interrupt you into we haven't actually talked about what the name of the module is, but it's actually, so it's neuroendocrine cancer when it's not part of the typical lineup, and you can see our star patients along, and I don't know if you can see, because you probably looking at a really small little image on for people, but our key patients are looking like they're part of a police lineup. So for us, we wanted to sort of open GPs' eyes to the thought that perhaps it might not be the usual suspect, it might be NETs. So sorry, I wanted to just highlight.
That's all right. Because
I didn't have. I apologise in advance.
That's all right. We can't have fisticuffs because we're not sort of.
Anyway,
you've got your little unicorn with the little punching things anyway. So So it's very much the basics and sort of going through what different types of nets and everything there are. Then module 2 goes more into management of specific nets, and it goes through and talks about each of the medical treatments, surgery, the whole everything, your PRT, and we've got case studies through each of the modules as well, so that the GPs are actually able to think of this as a real person, and actually were real people that our clinicians on the steering committee, they put the case studies together. And so it's been broken up into pieces so that we go through each of the case studies, but with the relevant section of information being given, and then they have short answers and everything to do, and they've got click boxes that they've got to put different things into as far as whether it's an investigation for a PNET or a GEPNET or a lung net, or so it's making them think rather than a GP or just having a module where you just keep clicking through, and at the end of it you sort of think, well, what did I actually learn from that? But I finished it, and so I get a certificate. So we wanted to make this something that they had to think, so that it's not something that they can just click through. Module 3 is then doing specific nets, and that's looking more at the hereditary nets, and got MEM1, von Hippel-Lindau, Merkel cell, paragangliomas. There's a case study on paragangliomas as well. So that was in module 3, and then module 4 is living with nets, and we've got a lot in there about the psychosocial side of it, the dietetics, and there's a case study with the dietitian's input for a patient that's gone through, and we've also got financial toxicity in there. So we've tried to cover absolutely everything that we feel net patients go through, and have the GP aware of all these things that these complex cancers cause. And it's not like your mainstream cancers where you follow a set prescription basically for your treatment, and then you do this and you do that. We know all our nets out there are so unique and so intricate in what they need, and we want to make sure that these modules cover that.
So we've talked a lot about GPs because
Yep.
that was the original dream was, well, gosh, we've got to get patients diagnosed earlier and we've got to have GPs who know how to manage them ongoing. But then there was the thought of, well, is it only for GPs? Are GPs the only health professional who need to learn about NETs? So we've dreamed a little bit bigger, and maybe you can tell us a bit more about that.
Yep, sure. So, I mean, yeah, we know that, well, it's carcinoid. It's not really dealt with greatly in med school. And one of the GPs who filled out one of our surveys originally, she said that she had been diagnosed with a neuroendocrine tumour not that long ago. And she said she's only, I think, late 30s, early 40s, and said, we didn't do anything really at med school. So everybody was very sort of, no, there's nothing wrong. Luckily, her being a health professional and having a friend who was a surgeon, they did a bit of investigating and sort of found that early. So that was why we thought this is really important. However, one of our steering committee said, I would love to give this to my registrars. So we've now broadened the horizon and made this available to registrars and also to nurses. So, but we do emphasise with the nurses, we are going to go through proper accreditation so that they will actually get more points for it rather than just doing it and getting a certificate at the end. So that's a work in progress, but in the meantime, they can do it. They just have to go in with their APRA number and go away with answering the questions and learning. So I'm doing it myself at the moment, even though I put the modules together.
And I'm looking forward to doing exactly the same thing, because Meredith gave us a walkthrough of the modules the other day, and there were things in there that I was thinking, oh, I need to brush up on that too. So I'm really looking forward to completing it as well. So if you've got an eShine nurse or a practice nurse at your GP clinic, it might be for their benefit. It might be good for us to hold off on just for a minute for that, so till we've got that properly accredited, but they can go up and have a look. And and I can see someone's actually given us the most beautiful Dorothy Dix question, which is, how does my GP sign up? I swear I did not ask that person to ask that question.
Well, we're happy to answer it.
Lead to the next point. And I think someone actually emailed me and said, well, what should I actually say to my GP to indicate that I think they should do this course? And I thought it was a really astute question, because the last thing we want to do is put GPs' noses out of joint and make them feel like we don't think they know how to do their job, and it's not that at all. So I wondered if Meredith, if you've got some thoughts about sentences or ways in which, like, it might be useful for our patients to introduce the topic of the modules with their GP.
Yeah, well, I mean, I think one of the most important things with the discussion is talking about the increased prevalence of it, because, I mean, it's around about 17 per 100,000. So it's not a rare cancer. It's a less common cancer. And I think for GPs, we really want them to be part of the multidisciplinary team. We want them to be aware of what NETs involves. And I think that it's really important for them to be educated. Then when the reports come through from the MDT meetings and everything, they'll know what they're talking about, and they'll know from the treatments what side effects can happen, and that they can actually sort of be more instrumental in managing the side effects that do happen, or pick up something that might be a progression, or it might be just something that just needs simple management that doesn't necessarily need to go back to the clinician. But I think also, I mean, with the stats this year, 2020, there's estimated to be 4,972 new cases in Australia. So I think GPs, as with any cancer, I think they need to keep up to date with the information, and I think it's more satisfaction for them because they're aware of what's going on rather than frustration with not knowing why. So that's one of the things that I think. Have you got other thoughts?
I think it's always good to plug that something's free for health professionals, because often, we talk about going to medical conferences and things, but registering for a medical conference is hundreds of dollars. To be able to do a full year's worth of professional development, that's required for you to have your registration, for that to be free, I think is another really fabulous scorecard that and just to be clear, we did get some funding, didn't we, to
we did
this program. So that's
we had to pay the medical writers and the marketing and everything, but there's also the draw card of it being available to them to do in their own time, in their own home. They don't have to finish the whole module. They can be started and they can go back and continue doing it. So it's not like you don't have to sit there for an hour and finish it. You can sit there and do 15, 20 minutes, whatever. And then if you have to go away and do something, when you come back to do it, it's where you left off. So, so it's not, I think it's a convenience factor, and I know so many GPs are time poor, that it's really good that they can sort of do it if they've, in the comfort of their own home.
And people, we've got a section on our website, so if people wanted to direct their GP to find out more, to ask their GP to find out more, they can certainly look at our website, which is all the w's.neuroendocrine.org.au. But we've also got some flyers. Now, we're sending these out to our support group facilitators, and of course we're all still in COVID land and not meeting face-to-face tremendously much. So, but I can send a flyer out if you're really busting to give something. Sometimes a piece of paper is really good to give your GP. So get in touch with me and I can get our wonderful volunteers who work on Thursdays to send anybody out one of these flyers if they think they would like to give the physical version to their doctor. I can also just email out a PDF if that's easier for you to have an electronic copy to print out and give to your GP.
And I think you can actually go onto like our website under a healthcare professional and professional development as well, and you can print that off, so you could actually take that paper to them, and it's just got the email, the link anyway for arterial for doing it. So there's a few options.
Fantastic. I'll make sure that that's all in our notes so that people can find that really easily. So actually, someone's just asked a fabulous question, which is, and I don't know the answer, so I'm hoping you might, and if you don't, then we'll find out. Gastroenterologist, so someone's asking, can my gastroenterologist access it as well? They've also said, I wouldn't mind a squiz so that I see if I pass as a patient. I'm not sure.
We can't do that. No.
I think you need to provide a number, don't you? But
you do.
Can specialists do it?
Well, they could put down that they're a registrar. We could look at, I possibly don't want to go back to the marketing group at the moment because we've fine-tuning little bits.
An individual question if you've got a specialist who you're wanting to talk, maybe just get in touch with me and we can have that conversation offline.
Yeah. Oh, I'm happy sort of if anybody wants to contact me, if there's enough of them that are interested, then I can always approach the marketing committee to get another drop-down box, because they've got APRA numbers so they can do it. It's just the fact of actually when they're going into registering of saying who they are. So
it's a good idea to the ideas person.
We would love everybody to do it.
Exactly. And I love the fact that these ideas come from group members, because they've always got ways of, they've got new questions and things to make us think. So I love that. I'm just having a look at my list of questions that I was going to ask you and see which one. What I was going to say is, how do we know how many, will we know how many GPs are doing it? What sort of information will we get about who's accessing it?
Okay, so I will be getting a monthly report from Arterial, and they'll let us know how many sort of click-throughs, how many people register, how many people complete. We can actually have a breakdown of each of the questions to see if there's any areas that maybe aren't getting answered quite the way they should, or they're not answering it properly. They have to answer every question for them to progress through. However, we could get analytics to find out if there's an area that maybe the way we've asked the question isn't clear enough to them, or we maybe need to provide more information. So it's, even though the modules are done, we're able to keep going through and refreshing any new information, updating it. But we also want to make sure that it's useful to the GPs and that we're asking questions that are appropriate for them and helpful.
Brilliant. Well, I'm so excited about this program. As I said, it's been a long time in gestation, and it's fabulous to be able to celebrate a birth notice of a new program. Meredith, is there anything that I've forgotten to ask you that you wanted to mention?
I'm just thinking there possibly isn't. I think for our list, I think we've covered off on all the things that we thought about.
Well, maybe I'm going to talk a little bit about what's coming up for us over the next week or so, and then if there's any sort of closing thoughts you've got that come to you, then
sure.
Welcome.
I can jump in.
Exactly. So thank you. It's been fantastic talking about it. I'm so excited and I'm so thrilled to anticipate, hopefully everybody's GP doing.
I can just jump in now. Like it went live on the 9th of November and we wanted it to be live for the 10th of November being World Neck Cancer Day. And within 24 hours, we had 5 GPs who had already started it. So, so I'm hoping that we've had 40 so far. Dream big.
And maybe we'll keep it posted. And if you've got a GP who has done the program, maybe let us know. I think that would be really great to know as well. So I'm going to do just a little bit of news about what's coming up in the next week or so. First thing is Monday evening, if you're in Melbourne time, it's at 7:30, and if you're in other places, it's various other times in the different time zones. So 7:30 till 8:30, we've got Erin Lang. So Erin is our other NET specialist dietitian, and she's based here in Melbourne. And lots of you have heard me talk about Erin because she has been completing her PhD into the nutritional and supportive care needs of people with NETs, and also done a lot of work interviewing and surveying health professionals about their knowledge of nutrition in NETs. So Erin has finished that research. She's finished writing it up. She's in the final throes of PhD submission hell, and she's just about to have a baby too, which is so. As if she didn't have enough on her plate, she has very kindly agreed to do a webinar with us to really present the results of that research. And, some of the results she's already published, some of the results are now in standard practice, and that's part of the advice that I talk to patients about when they ring me with, when we're talking about nutrition and NETs. But I'm so thrilled to have Erin come along on Monday night, and she's going to present the entire findings. It's free, so you don't have to pay to be part of the webinar. We're strictly limited for numbers, and we've got about 25 places free. So we've had a huge uptake, which is not a surprise. But if you haven't registered, then get in quick. There's a couple of people who've been extra diligent and registered twice, so I'm keeping a careful eye on them. You only get one registration. But look, and the other thing is that health professionals are also welcome to come. So if you're watching this, you were thinking that this was only going to be relevant for patients, it's actually going to be fairly high level information. And along those lines of that, because Erin's going to be presenting quite technical information on Monday night, we know that people might have quite a lot of questions to ask Erin. And so she's actually coming back to sit with us next Friday in the hot seat of Facebook Friday, and we'll have a chance to really get some really good Q&As going. And although she won't be able to obviously provide individual medical kind of advice, she'll be able to provide some general guidance. And so I'd love you to be thinking of your juiciest questions to ask Erin about. So everything you've ever wondered, today in the Facebook private discussion group, I was hearing people talking about gut health and hair. I was hearing people talking about going vegan. I was hearing all sorts of it, and maybe my little antenna are up because I know this is in the pipeline. So I'm really looking forward to getting Erin into our group space to answer those questions as well. So that's Monday night is the webinar, and then Friday is the Facebook Friday with Erin. The other thing to know is that we've got this week lots of our support groups are having their final meeting for the year. Now, as we know, coronavirus has meant it's meant that lots of groups can't meet face-to-face. In fact, all of our groups haven't been able to meet face-to-face. And so Zoom has been our new way of working. And we know, Zoom can't replace face-to-face interaction. We know no one can pretend that it's the same as sitting in the same room as each other. Having said that, there's still so much connection that can happen via Zoom when we hear each other's stories and we get a chance to share our own story and provide suggestions and strategies and tips and jokes and laughing and things together. And so I have seen lots of conversations in our Zoom groups where there has been that sense of shared camaraderie and support. So I'm not trying to do, I'm not just trying to talk you into doing something you don't want to do. But if you haven't tried a Zoom meeting and you've been sort of too worried about it, well, a lot of people have actually given it a go, and it's not overly difficult. We send you a link, you click the link and it downloads a little program onto your computer. So it's not a virus, it's actually just a Zoom little plugin that goes onto your computer. And that means that you have a conversation with the other people in the group. It's actually quite similar to what you can see Meredith and I doing, in that you can see everybody's images on the screen if they've got a camera turned on, and you can hear each other's voices. So it's a really worthwhile thing to try. And along with that, our New South Wales group this week have got it was actually our Ron North Shore group, but they're hosting all of our other New South Wales groups in an extended invitation, because we've got a guest speaker, Liz Bailey, who's a nuclear medicine physician from Ron North Shore Hospital, who's been intricately involved in all of the setup of the PRRT program there, and she's going to be talking about nuclear medicine and NET. So that's a chance to really again, have your questions answered, get some new perspectives, some new information about this really, it's a real hallmark of treatment for neuroendocrine cancers. So if you're in New South Wales in a support group, you'll get either you will have had an invitation. I think Meredith sent a whole heap of invitations out.
And Canberra as well. So
Canberra, sorry ACT. Wales today. But if you haven't received any information about that New South Wales meeting, training my neck over at my diary, which is on my other desk. It's next Tuesday.
Yep.
What time is it, Meredith?
It's 5 till 6:30.
5 till 6:30 next Tuesday. Yeah. And that's Eastern Daylight Savings Time.
Yep.
So the other groups that are meeting next week are Brisbane and Perth, and Canberra has its own meeting as well. So if you're in Canberra, you get really spot for choice with Zoom meetings. But our Perth buddies over in Western Australia and our people up north, you've got your Zoom meetings next week, and then the following week we've got our Melbourne final meeting for the year as well. So if you're interested in those meetings and you haven't got any information about those, the best way is just to get in touch with me. And those of you who know me well know that private messages on Facebook get lost, but emails are a much better way for me to keep track of everybody. So my email address is kate@neuroendocrine.org.au. And if you want to ask Meredith questions about the GP program, for example, it's meredith@neuroendocrine.org.au. So just so you know that. I'm just thinking if there was anything else I was going to plug, and I think I'm just about the end of my list. Meredith, was there anything else that you wanted to mention?
I just thought when you're talking about Zoom sessions and things, that if anybody has nurses or one of the clinics or something that they go to, and the nurses want education or in-services on neuroendocrine tumours of any degree, happy to do in-services for them via Zoom. I've done quite a few for Queensland and some in New South Wales into the major hospitals. And you can actually just do that through our website. It's book an in-service. So if the nursing staff want to get any information at all, I'm happy to customise it to what they need. And yeah, we've been getting sort of groups of 20 or so nurses in their in-service time, whether it's 8 o'clock in the morning or 3 o'clock in the afternoon or whatever. And we've just done that, and it's been an open session for them to ask questions, but also to get some information. So.
And you also do training on injection technique, don't you, as well, Meredith, for nurses? So I know that is a topic that recurs, is, how do I subtly get the nursing team at my local hospital to maybe upskill a little or refresh their skills in giving these butt harpoon injections well. So Meredith, you're an expert in butt harpooning, and you can also provide a sort of training in that regard as well.
Yeah.
So I'll make sure there's a link to that part of our website in the notes as well. It's a good thing to remember to plug, because that's something that you look after, and then I don't. So
Yeah.
it's not in my awareness so frequently. But yeah, you're right. It's great to emphasise.
Lovely.
Okay, I think we are just about done. I'm just looking through the notes, and a few people are really keen to get the PDFs of the flyers, so I'll make sure they're in the notes.
Wonderful.
I hope everybody has a safe and enjoyable weekend. We're feeling and sending our love to feeling for and sending our love to people in South Australia who are still feeling a bit worried about the community transmission of coronavirus. And can I just say, I'm wearing my celebration top today because in Victoria we've had a whole 28 days without any local transmission of coronavirus, which is pretty amazing feeling. So we're excited down here, and I know a lot of people have been impacted by that and continue to be impacted. I heard recently about delays in colonoscopies in Tasmania and the public health system. So we know that the health system is, even though our numbers are so incredibly low now, the health system has had to really make huge adjustments, and it's been a big impact for people affected by cancer in Australia. So once again, the reminder is always, if you're struggling, if you're just feeling like you're not getting anywhere and you need some help, you're welcome to get in touch with me, and I can see if I can help sort of strategize about where the best place to go is, or the best thing to do is to make sure that you're able to access the care that you need. So you're welcome to get in touch with me about that. I think that's it, isn't it? Let's finish and have a fabulous weekend, everybody. And we'll look forward to seeing lots of you at the webinar next week, and in the Facebook private discussion group, and next Friday with Facebook Friday with Erin. So take care, everybody, and I will talk to you soon.
And thank you for having me, and nice to virtually see everybody. So take care.
Thanks, everybody.
See you.